Hello, it's Dr. Andarcia on the Healthful Roots podcast. Today, I'm excited to have Dr. Lauren Ramsey, who's a breast surgeon and medical director of a multi-specialist group, as well as assistant professor of surgery at the TCU Burnett School of Medicine and CEO of ProtectMed, which is a device developed for a more comprehensive radiation protective, which was made specifically for women in mind.
Thank you so much for having me. I'm honored to be here today. We have lots of good things to talk about.
Yes. So I just wanted to start a little bit about you and what inspired you to become a breast surgeon and focus so deeply on women's health.
Yeah, so breast cancer is just such a common disease. I feel like everyone knows someone, a family member, or a friend who's been affected by breast cancer. So my grandmother had breast cancer, and this was kind of back in the day where the options for reconstruction and surgery were more limited. So I kind of just remember I was really young, but just remember seeing what she had went through. And when I got to medical school, I really loved surgery. I love having that kind of hands on approach and being able to help fix a problem. And what drew me to breast surgery specifically was, taking into account that kind of family history that we had in our family, as well as the relationship that breast surgeons get with women. A lot of surgeons, they see a patient, they take out the gallbladder, take out the appendix, and there's not too much of a longitudinal follow up. But with breast cancer care, you're really being just an advocate for that patient just throughout the rest of their lives and checking in with them and having that follow up. And you get to counsel them whenever they're, coming in with a diagnosis. And so there's a lot of emotional aspects of it. And I just love dealing with that with women and giving them hope at a time that seems very overwhelming.
Yeah, that is nice. I didn't know that you had that longitudinal follow up with your patients.
Yeah, so the first few years, I see patients every 6 months, and then about after 3 years after they're done with their surgery, we see them yearly. So just to make sure that they're getting their screening mammograms, just checking in, seeing how they're doing, if they're on any adjuvant therapies, like if
Mm.
they're on endocrine therapy, seeing how they're dealing with hot flashes or things like that, and just checking in on their overall health, and of course, doing a breast exam.
Okay. Well, there's a lot of things that I want to ask you today, but I wanted to start with some important topics around breast screenings, right?
Yes.
And when do you think that patients should start?
So the recommendations are starting at the age of 40 for your annual screening mammograms, and that's if you are at an average risk. So if you have a family history of breast cancer, then the recommendation would be changed depending on when that person was diagnosed with breast cancer. So if they were diagnosed at 40, we would want you to get your screenings earlier than that. But if you're an average risk, if you don't have a significant family history of breast cancer, we recommend starting screening at the age of 40. I recommend the manual breast self exams to patients kind of starting at any age, 30, 35, just to get what we call breast self awareness. So, what that is that just making yourself aware of what your breast normally feels like, normally looks like, and doing that about once a month. So, I recommend timing this at a specific time of every month because your breast can change depending on where you are in your menstrual cycle, as women listening probably know. So, say you're going to do it at the first of the month, that will be pretty consistent. Then your breast will kind of be at the same hormonal level. So, it involves two aspects. The first aspect is looking and seeing what your breasts look like. Do they look symmetric? Like, take a look at the skin, your nipples. And then the second aspect involves feeling, and that's when you actually do a manual exam. So you're feeling to see if you notice any spots that are hard, any little lumps, if you notice your nipple is retracting, or if you can express on any nipple discharge, and just kind of taking note of these things. And you can bring them up to your doctor if you feel anything abnormal. So I encourage women to do that. We're seeing in the news, a lot of young women, influencers, celebrities getting diagnosed with breast cancer at younger ages. So I think just having that awareness is powerful.
Yeah, and I saw that you had some two really good videos on your Instagram where you're showing like what position to be in and what to do. So I encourage anyone listening to go check you out on Instagram because I thought that was helpful.
Thank
Uh,
you. Yeah, I try to make it pretty easy. It's, it doesn't take long, but you just want to be comfortable, have a space, and just make it part of your routine.
Yeah. And so, talking about the rise in breast cancer, what are some factors that you think are contributing to that?
So there's a lot of factors, and we obviously don't know one specific factor. It's definitely multifactorial. But obesity, we know that that's a risk factor for breast cancer. So your body has an enzyme that can convert fat into estrogen. And basically, breast cancer risk increases as a woman has more estrogen exposure over their lifetime. So the more estrogen your body is seeing and your breast are seeing, then the more high you have a higher risk of breast cancer. So, as we have an obesity epidemic in America, we're seeing more breast cancer. Along with that is with childhood obesity, we've seen that there's a trend that women or girls are starting to get their menstrual cycles and start their periods at younger ages. So, the number of menstrual cycles over a woman's life, that also increases your risk for breast cancer because that is more estrogen exposure. So, with women starting their cycles earlier, they're getting more estrogen exposure from younger ages. Another thing that I think is interesting is how a lot of women are delaying having children till later in life. We know, I'm sure a lot of your colleagues in medicine and stuff, a lot of women are doing their careers and doing medical school and residency and all that, and delaying having women till maybe they're late or mid to late 30s or even later, which is perfectly fine. But that also increases the number of menstrual cycles you have. So that can be a risk factor for breast cancer as well. And then, of course, we're hearing like every day new toxins in our environment, the plastics, the different chemicals, those things that are just kind of like surrounding us that we can't really control. But hopefully, those will, be changed and we have some stronger regulations to reduce our risk.
Yeah, I mean, those are definitely important, especially because there's not really a whole lot you can do as far as some of these environmental factors. But what about diet? Like, how would you counsel someone on diet to decrease their breast cancer risk?
So, kind of the things that you talk about, and I know that you've done a lot of work with like fertility and diet with that, they kind of really overlap. So, antioxidants, so things like berries, that's, protective, your healthy fats, your good oils, whole grain, avoiding the processed foods, avoiding the seed oils. Um, just none of those crazy like like crazy sugars. So just kind of overall eating like whole real foods. That's what I counsel my patients on, and just kind of doing everything in moderation with that. I think that that's the best way. And of course, exercise as well. We definitely encourage like 30 minutes a day for, 5 days a week. So 150 minutes of exercise to help reduce your risk and just kind of to stay active.
Yeah. Yeah, I think that's all important for many things, not just breast cancer, but yeah, that's
Right.
but yeah. And so one of the questions that I wanted to ask you was about the different screening methods, right? So we know that mammograms is like gold standard for screening, but what are the other options and when would you do those options?
Yeah. So we do recommend mammograms starting at the age of 40 annual for women who have an average lifetime risk. Some people do have a concern about the radiation risk of mammograms, and a lot of patients ask me about that. Like, well, if radiation is a risk factor for breast cancer, am I actually increasing my risk by getting a mammogram? And the answer is no, because it's a very, very small dose, and also you're only getting this like once a year. So when radiation exposure is a risk factor for cancer, that's more in people who are around it every single day. For example, like healthcare providers who work with radiation, interventional cardiologists, orthopedic surgeons that are doing it, high doses of radiation multiple times a day for procedures. So a mammogram isn't going to increase your risk of cancer, and that is still our gold standard of how we detect cancers, and we're doing a great job. We're finding them a lot earlier and being able to treat women with a lot of options because we're finding them earlier. The other major screening method is an MRI. So This is recommended for women who have dense breast or for younger women, because younger women typically have denser breast. As you age, your breasts become more fatty, and so that makes mammograms more. It makes cancers easier to see on a mammogram,
Mhm.
because on a mammogram, cancers appear white, but dense breasts also appear white. So it's hard to see a tumor in a mammogram if you have very dense breast. So that's why the MRI comes into play. So for women who have dense breasts, we do recommend an MRI. We also recommend MRI for women who are high risk for breast cancer. So if they have a family history or if they had biopsies that had high risk features, so if they're at a greater than 20% lifetime risk of breast cancer, we recommend getting an MRI at 6 months and then a mammogram at 6 months. There are some newer studies out there. There's thermograms. There are some other new things that I've seen. I haven't personally used those in my practice, and I think that they can all be helpful. But I still think that you should get a mammogram just for diagnosis. But these new technologies, they could definitely have potential, but I think they just need more time to make sure that they're catching all of the cancers.
And how often should you be getting the mammograms?
Every year, so yearly, starting at the age of 40. And then unless for some reason you have an abnormality, and then you're when you meet with your doctor, they'll tell you like, hey, we need to get another mammogram. And usually they do an ultrasound with a mammogram as well.
Hmm.
So they'll do a mammogram and ultrasound, and some lesions require a 6 month follow-up. But if overall your mammogram looks good, then yearly mammograms.
Okay. And are there any common myths or misconception about breast cancer that you see often in your clinic that you'd like to debunk?
Yeah, so I think that breast cancer always is going to present as a lump. That's definitely a myth. A lot of times it doesn't present as anything, and women just go and they get a mammogram. For example, I had a woman I just saw this morning, and her cancer was only 7 millimeters, so it's less than a centimeter. So you're not going to feel that, but it's just something that they saw on the screening, and they're like, "How did I have cancer? I can't feel it." Well, it's because a lot of times the cancers are very small. And that's actually good, because this way we can offer different types of surgery. We can do breast conservation where we preserve the breast. Another myth is that men can't get breast cancer, and men actually can get breast cancer. It's a much lower risk. They have like a 1% risk of breast cancer. But if a man does get breast cancer, then we send them to get genetic testing and make sure that there's not a gene that's associated with it, because sometimes that can be the case.
Okay. Yeah, those are important to know. And there was something else I read on your website, which I mean, I guess more and more we're finding out about birth control and like what it can do, but about the IUD specifically increasing risk.
Yeah. So IUDs increase breast cancer risk. Well, sorry, hormonal IUDs can slightly increase breast cancer risk. And this is about the same rate that OCPs, so your oral contraception pills, can increase breast cancer risk. Again, this is all related to the hormones. So we know that OCPs slightly increase the risk. It's just something that women have to take into consideration. And basically the hormonal IUDs have the same risk. It's small, but it's there. The copper IUD or non-hormonal IUDs do not increase the risk. So this just the patient has to talk with their doctor about this, and you just have to take it into consideration. Like, I know tons of women who use IUD or OCPs, and even physicians or whatever, we use them, and we just accept that risk, and we maybe then make other lifestyle factors, like I'm gonna eat healthier, I'm gonna exercise, I'm not gonna drink alcohol, things like that. But some women who maybe have a family history of breast cancer and they're already at a higher risk, then maybe they should consider things like the copper IUD, where you're not going to be seeing those hormones if you already have a high risk of breast cancer. That's kind of what I tell my patients.
Okay. And touching on diet for a second, because I saw it, you talk about this as well, is seed cycling through the
Yeah.
month. What do you do that for?
So that's not specifically to reduce breast cancer risk, but I've incorporated that into my diet just to help regulate hormonal balance.
Mm-hmm.
I've seen a lot of patients and friends suffering with things like PCOS and just feeling like their hormones are off, and that can be related to so many different things like our those toxins and all just so many different factors. And I have incorporated seed cycling, where basically you incorporate either sesame or flax or pumpkin seeds into your diet at specific phases of your cycle. And it's been helpful. I mean, I don't think that there's like giant studies that prove that it's been shown like in the science, but I do think that these seeds are healthy. They provide a lot of nutrients, they provide fiber, and a lot of different vitamins, and they can just be a healthy way to help regulate a female's hormones.
Yeah, I've heard patients do that for like fertility. So it was interesting
Okay.
that you were talking about it because I haven't heard about it too much.
Okay, yeah, I was going to ask if you have, with your fertility work, if you had, like, I don't know, heard about it at all.
Yeah, I had heard it, but I haven't really incorporated it. I'm more on like the Mediterranean diet side,
Okay.
which I mean it's kind of similar because there's a lot of seeds and nuts, I guess, in there
Yeah.
as well. And one of the other things I wanted to kind of talk about is breast cancer treatment,
Okay.
right?
Yeah, so usually women have two options for treatment, especially if we're catching the cancer early and it's not too large of a tumor. Um, For surgery, we recommend either a mastectomy, which is the traditional approach where we remove the whole breast, and that can be accompanied by reconstruction. And a lot of patients don't know this, but the reconstruction is actually all covered by insurance. So there was a law that was passed that mandated that insurance companies cover breast reconstruction. So I think that's really good because it empowers patients to have reconstruction, and they also can get a procedure done on the other side. Like, for example, say they're getting an implant on their right side that has cancer, but to match that, they need a lift on the left side because an implant looks, more full and has more volume at the top. So say they wanted to lift on the left side, that would also be uncovered. That would be covered by insurance as well for the reconstruction. So there's a lot of different options now with reconstruction. We have the traditional implant reconstruction, and then we also have what we call autologous reconstruction, and that's where we take flaps. So basically, we could take tissue from your abdomen or your back or your thighs and create breast out of your natural tissue. So some women are leaning towards that method because it doesn't involve the implant. Some women don't want to have that foreign implant in them. So that's really cool, and the results look very good and very aesthetically appealing. Someone when you wouldn't even know they had a mastectomy. So that's kind of one option for surgery. And then the other option is what we call lumpectomy or breast conservation. So that's where we just remove the tumor itself, but then we leave the rest of the breast tissue. And with that, you don't necessarily need reconstruction, but the breast surgeon likely does something called oncoplastic surgery. That's what I specialize in. And basically, that's where we kind of rearrange the breast tissue that's preserved to kind of fill in the gap,
Mm-hmm.
so you don't see like a big defect. And after the lumpectomy, women usually need radiation. That kind of goes hand in hand to reduce the risk of the breast cancer from coming back, since we did preserve the rest of the breast tissue. Things like chemotherapy, immunotherapy, those all still play a factor depending on the type of breast cancer that you have. If you have a cancer that's called a triple negative breast cancer, that means that it's not responsive to the female hormones. We have immunotherapy. If you have a breast cancer that's called a HER2 positive, this is another protein that can be on cancers. We have a targeted therapy for that. So those are kind of medications. And then, as I said, radiation can sometimes play a role depending on what type of surgery and how big your tumor is. So we always talk about surgery, radiation, and chemotherapy as the aspects of treatment for breast cancer. And usually during that, we also check, during surgery, you also check your lymph nodes to make sure cancer hasn't spread.
Okay. And one of the questions that I have, do you think that one is better than the other, like mastectomy versus lumpectomy? Because some people will be like, I don't want to deal with it, just do a mastectomy.
Yeah, so I think it depends on the person. And the overall survival does is equal. So that's in the studies when they looked at the survival of patients, it doesn't matter which surgery you choose, that you will live the same amount of time. There is a slightly higher risk, only about like 1 to 2%. There's a higher risk of local recurrence with the lumpectomy and the radiation, but it's a very, very small, especially if we're doing the lumpectomy and the radiation. And then also, if you had a tumor that was responsive to the female hormones, if you take an anti-hormone pill, that really, really reduces your risk of it coming back. But it's about like 1 to 2% higher than the mastectomy. But we still tell women, if they're getting a mastectomy, the chance of it coming back is still not zero, because we can't eliminate 100% of the breast tissue. It's still about a 1% chance. So I don't think there's a better choice. I think it depends on like the woman's stage of life, like how many surgeries they want to go through. Because the mastectomy with the reconstruction, it's a lot, because you're getting the initial surgery and then you usually have to come back for another surgery to do the final reconstruction. So it's more of a longer process versus the lumpectomy. You go home the same day, you get the radiation, which that does take several weeks to do, but those are short treatments and you can kind of get back on to your life. So it depends on kind of where the woman is in her stage of life. I see more younger patients probably leaning towards the mastectomy, and more older patients who are like older than 65, they're like, I just want to do the simpler surgery.
Okay, that makes sense. Yeah, that's what I had seen, more like young women going for the mastectomy, so that's why I wanted to ask
Yeah.
that.
And we also do genetic testing. So if any woman is less than the age of 50, that's an indication for us to do genetic testing. So
Mm,
say you have a genetic mutation, then that would lean us towards doing the mastectomy, and probably a mastectomy on the other side, because that means that all of your breast cells have that mutation, that you're at a higher risk of breast cancer. So if you have a genetic mutation, then we would recommend the mastectomy. And some women, they're just like, as you alluded to, they have anxiety and they're like, I don't want to have to go through mammograms for the rest of my life. Like I saw my mom go through breast cancer treatment. Like I'm just worried that it's going to come back. And then we can do a mastectomy. But I do tell patients that the survival is equal.
okay, well that's good to know. And from what I've seen and heard, and I think you also mentioned on your Instagram, is that because we're catching it earlier, like the survival for breast cancer has also improved dramatically.
Exactly. So because of things like screening mammograms, we're able to catch it, before it becomes this giant lump or it gets into your lymph nodes. And because of that, our survival rates are like over 90%. They're very, very high. So it's reassuring to tell women, especially at early ages, when they come in and they're like, am I going to die from this? And it's like, no, like you're not. Like we're going to get you taken care of, and get you treated. It's the more advanced ones when it's already in the lymph node or in other areas of the body, then it becomes more difficult and things like chemotherapy come into play. But that's why the screening is really important, and we've been, good at catching them earlier and getting women treated.
And I just had a thought, like while you were talking about that, is you mentioned that like interventional cardiologists and orthopedic surgeons have a higher risk. Do you think that if you have a job where you are exposed to radiation or have a higher risk, that you should start screening earlier?
It's not routine. It's not recommended, just because there hasn't been that many studies on it. But I do think it's important to do the self exams, and that definitely is a good question. That's one of my passions, actually. That's what motivated me to start my company and develop my product. So I had a friend who was an orthopedic surgeon, and she went to medical school with me, and she had just finished up her fellowship and was starting her practice. She was like very young, like, in her 30s, and she got diagnosed with breast cancer. And unfortunately, she passed away 2 years ago. But it got me thinking about the risk and like why this happened. And I thought about the protection that we wear. And a lot of times we're wearing aprons that don't fit us. They're not custom, especially when you're a medical student and you're just kind of like throwing on whatever radio protection is around, and it doesn't fit, and it really keeps the upper outer quadrant exposed of your breast and also your axilla where the lymph nodes are. And the most common site of breast cancer is the upper outer quadrant of the breast. So I developed a shield, and it goes on with any apron. So it's compatible with any apron. So anyone can use it no matter where you work. And it's called the BAT. It stands for breast axilla thyroid, BAT, and it reduces radiation to the breast by up to 97%. So just adding something like that, like you're going to be a lot more protected, especially like every day if you're getting that repeated exposure.
Okay. Yeah. I had thought about that because of what you mentioned, but I guess there would need to be more studies. But I saw the bat, and that looks really cool. It actually looks stylish too.
Thank you. Yeah, I tried to make it a little stylish. I think that there's a whole area of radiation protection that can just use a style update. So I actually did reach out to Figs. I asked them if they wanted to partner to reinvent radiation protection, and they said not right now. But maybe if we get enough interest, we can get them to do it.
But you've been on Fox, and I saw that the American Medical Association recently said that they're acknowledging that there needs to be more protection.
Yeah, I was really excited to see that American Medical Association post and that resolution because I think it's really important. So I think it's starting to get, we're starting to build the movement, and that's really what I want to do. Just because I think that we deserve to be protected. Like we're all, dedicating our lives to help patients, and that's, wonderful. But we also need to be protected and not be increasing our risk of breast cancer every single day. And there's an easy solution just by wearing the bat. It's something that you can do. It's not hard. You just put it on. It's lightweight, and you can really reduce the radiation exposure. So I was working with a medical student, and I just felt so bad because she didn't have the bat and she had to wear this big apron, and it was just exposing her whole breast. And luckily we have another shield that I made her go stand behind, but she couldn't be like right up in the operating field with me. So it's definitely it's a problem, and I'm glad to see that the AMA is starting to support it because it really shows now that they're like invested in protecting us and reducing our risk.
Yeah, which I think is important. One of the questions I wanted to ask you before we kind of wrap up were what are some of the things that you do? Obviously for optimal health, but that can also decrease breast cancer risk on your daily routine.
Yeah, so exercise. I love exercising. I don't do anything too crazy, but I love my Peloton, Pilates, walking. So try to do 3 minutes a day. My husband and I like to go on walks. We live in Texas, so the weather is pretty good all the time. Um, I eat healthy as much as I can. I mean, I'm not like perfect by any means, but I do try to eat whole foods, fruits, eggs, apples, whole grains. I try to avoid the processed foods, and they can sneak up on you. Like I was in Whole Foods yesterday, and I was going to buy some, I don't know, it was like a sweet potato chip or something like that. And I looked and I turned it over, and it was all these seed oils. So you really just have to look at the ingredients label. So I've been trying to avoid seed oils. I don't drink alcohol. I did before when I was in college, but right now I just, have cut back well, I've actually eliminated it given the studies showing like that even a moderate amount of alcohol can, increase your breast cancer risk. It's, that's a personal choice. I think as long as you're doing everything in moderation, like it's fine, but I personally don't. I wear the bat. So during my procedures, I wear the bat, and I maintain positive thinking. I do think that that's important as well. And just, positivity, trying to kind of be like an optimistic person. Like I do believe that your thoughts and your, just how you like live your life and your overall demeanor can like help you feel better. I believe in God and my faith, and having like that, and like that's been actually shown to help to have better outcomes for patients, people that have like a faith in something or a strong support. So talking with my family and friends.
Yeah, and that's an interesting one. I was I mean, not surprised that you said that after seeing your Instagram, but I don't think that a lot of doctors put a lot of like belief, I guess, in that, or maybe we're just not taught it, so we don't really talk to our patients about that. But I do find that that's something that some of my patients are missing sometimes, and then you wonder, like, how can I help you cultivate? You know, it's like a hard thing to help someone cultivate, but I do think it's important for overall health.
Yeah, I think so too. I mean, there definitely have been studies about people who have like a sense of faith and like a support network and like positive thinking, more like the palliative patient population and like even like cancer, like later stage cancers, showing that they have better outcomes. And I don't know why that is, but I do think that like positive thinking and even like manifesting and just like hoping that like good health and just I don't know, prioritizing your body and your health and your thoughts, that can be very powerful.
Yeah. Yeah. I think maybe it decreases inflammation in some way or another to think that way.
Yeah,
But
I think so too. Yeah.
yeah,
I mean,
just
I've seen things about like how negative thoughts can like, I don't know, can kind of like affect the, inflammation. And we know that stress increases inflammation. So like chronic stress, which obviously none of us can eliminate stress, but when you're thinking positively or practicing in mindfulness, those do decrease stress, which, would decrease your inflammatory response, which could theoretically decrease your risk of cancer. So I think it's definitely all connected. And then try to get good sleep. That's always important too. I try during my training, obviously, as you know, it's hard to get good sleep, but really prioritizing that and because that's really important as well. Just give your body time to like recover from everything during the day.
yeah. Yeah. And I think sometimes we overlook the simple stuff like diet, nutrition, sleep, stress management, and we want to jump into like all the supplements and the biohacking stuff. But I think if the main things are not down, then kind of still
Right.
missing out.
Yeah.
So I want to thank you so much for your time today. I think this was really important conversation. But I just wanted to open the floor if you have like any final thoughts or anything that you want to mention.
Yeah, I think just encouraging people just to, be as healthy as you can. And obviously, like, none of us are perfect, but kind of what you were just saying, like, prioritize the simple things like eating a well balanced diet, getting your exercise, avoiding alcohol, all these things you really can do to decrease your breast cancer risk. And I am grateful now for all these like platforms that we have, like podcasts and the social media, because now I feel like women are more aware about
Mhm.
breast cancer and they are, doing their self exams because they're seeing people get diagnosed earlier. And if you do get diagnosed, just know that like you're going to get taken care of. Like we have great survival. We have a lot of options, even if you're young and if you want to have children. Like we have a lot of advances now where we're able to offer you a lot of things. So, it's not the end. It's just like a journey and there's a lot of support out there and you'll get through.
That's great final final words. And I would also say I encourage anybody who listens to follow your Instagram. I love all the information that you put out there. It's very educational, and so is your website. So I followed some of those links and like read the articles that you had there. So
Oh,
I thought that it
great.
was really awesome.
Great. Well, thank you. Yes, I'm trying to, use the Instagram like you are and use the podcast to educate people and hopefully that it will help someone.
Yes. Well, thank you, Dr. Ramsey. I really appreciate your time, and I know this podcast episode is going to help a lot of people.
Thank you so much and Happy New Year.
Happy New Year.